For Go ahead.
Hello, my name is Elisa Mills, and today I'm joined by Gene Ransom, the CEO of MedChi. We are here today to talk about the value-based care and what is next for physicians.
Oh, it's great to be here with you today, Elisa. Really appreciate having a chance to talk about value-based care. MedChi is a leader in Maryland value-based care efforts, particularly for physicians and other practitioners. So it's something I could talk about all day.
Fantastic. Thank you so much for joining us. Can you tell us a little bit about MedChi?
Sure. So MedChi, for those who aren't familiar, is the Maryland State Medical Society. We're the seventh oldest medical society in the United States. We represent physicians. We're actually the largest physician organization in Maryland, and we do everything pretty much a physician needs as the foremost advocates for physicians, patients, and the public health of Maryland.
And how does MedChi support practices?
Well, MedChi has multiple ways it supports practices. You know, we obviously lobby and advocate in Annapolis for physicians, but we have three principal centers. The Center for the Private Practice of Medicine, which is really helping doctors who want to remain independent be successful. We do everything from helping them with our care transformation organization, with Unity Insurance, who can do a free insurance review, with our collection company that does physician-friendly collections, to all kinds of different services for private practice. We also have the Center for the Employed Physician, which helps doctors with their employment contracts and other items like that, salary survey data, things that they need. And I guess what we're going to talk probably the most about today is the Center for Value-Based Care. MedChi's Center for Value-Based Care is really unique. We're the only state medical society putting this kind of resources into value-based care. And a lot of that is because of the long-standing unique rate setting system that we've had in Maryland and the Medicare waiver, which has caused us to be really focused on it. The Center for Value-Based Care really focuses on helping practitioners be successful and protected in value-based care arrangements. If you go to our website and go to the Center for Value-Based Care on our website, you can see we have information on uh, private contracting and legislation that passed around value-based care. We have information on the total cost of care agreement, which is what we're involved in with the federal government right now. We have information on the Maryland Primary Care Program and other primary care initiatives, as well as EQIP. We also are building out and doing a lot of work on AHEAD.
What is ahead?
AHEAD is the agreement the state of Maryland is working towards heading into. Essentially, the total cost of care agreement is part of a Medicare waiver that is coming to an end at the end, under the contract the state has with the feds at the end of 2026. But before the election last year, Governor Moore signed the AHEAD agreement with the federal government, which will continue that Medicare waiver and change the way that Maryland hospitals are paid again with the federal government. The AHEAD program is an acronym for what the federal government moved the state of Maryland into in order to move forward and continue with their unique system. However, this agreement does denote a little bit of a change, and a lot of the details of the agreement that was signed back in October, November of 24 have to be worked out and are being negotiated right now. So that is something that if you're a physician and you're interested in value-based care, frankly, if you're a physician and you're practicing in Maryland, you should really pay attention to what's going on with the head.
So, what are some of the new programs for any primary care doctors in the ahead model?
So, with regards to AHEAD in primary care, the way the agreement is crafted with the federal government, we keep the unique Maryland primary care program, and I'll talk a little bit more about that. But there are two new opportunities in this agreement that are going to be launching soon. The first is the Primary Care Ahead program, which we still need some details on to understand from the federal government. But doctors are going to be able to sign up for Primary Care Ahead starting this summer. And essentially, this is an ACO-like model that has care coordination and community service. Again, it's another primary care, value-based care like program. So as we move forward, we're going to get more details, and this is one of the things that physicians are going to be able again to sign up for this summer to start doing on January 1 of 26. Now, the other program that is going to be new under under AHEAD actually comes out of the Maryland Primary Care Program that I mentioned earlier. The Maryland Primary Care Program has been in place for quite some time now. It was under our total cost of care, and this is a Medicare value-based care program where physicians get paid extra fees to manage Medicare patients in Maryland. About two-thirds of Maryland's adult primary care is in MDPCP. It's a great program. Unfortunately, because of the transition to AHEAD, they're not allowing enrollment in the MDPCP program. But fortunately, there will be an opportunity to join the Medicaid MDPCP program, which is going to be a brand new program under this new document that Maryland is moving forward with. In the short run, immediately, right now, if you're in MDPCP Medicare, you've been given the opportunity to join MDPCP Medicaid almost immediately. So if you're in MDPCP traditional, you really should look into this and see about this opportunity, or reach out to MedChi or the Maryland Primary Care Council to find out more about this. Essentially, it's a program where physicians are going to manage their Medicaid patients at a higher level with care coordination and try to have better outcomes. The good news is it's not going to just be limited in the long run to participants of the Maryland Primary Care Medicare program that does not have open enrollment opportunity right now scheduled or planned. It is going to be open to other practitioners as well, and more details on that will come out soon. So if you're a primary care doctor, this is another new opportunity that you're going to want to really put a note on your calendar and pay attention to as we continue to move forward.
Definitely. Those sound like great opportunities. Is there any opportunity there for non-primary care doctors?
So this is probably the coolest one, and in fact, we just released in another video and I can put it in the notes on this one, an overview of the episode quality improvement program and the new bundles that have been released. And Elisa, you'll be surprised to hear this, but we literally are launching for January 1 of 26 under the episode quality improvement program, 68 new bundles, bringing us well over 100 different chronic conditions and bundled payments that specialists, some primary care doctors, and other physicians can take advantage of. The Episode Quality Improvement Program is a advanced payment model program under the Medicare waiver that provides incentive payments to physicians, practitioners who improve the quality of care and reduce costs. It's upside only risk for the EQIP entities because the risk that's necessary for the value-based care program is taken by the state. Um, Participating care partners receive their payments like normal. They get regular fee for service payments, but they're looking at a particular episode or a chronic condition by CPT code to see if they can save money on that condition, on that bundle, for lack of a better term. And if they save money, they can win an award. So this program essentially gives you your fee for service, incentivizes you to get shared savings based on a target price that is set. And you also, if Congress funds the advanced payment model bonus, which they haven't lately, but if they do, because they have in the past, that means you can get an advanced payment bonus. And you also, right now, the way the current statute is written, get a modifier adjuster. So it's a pretty cool program. Now, you might be saying, oh my goodness, how do I get involved in this? Well, you reach out to CRISP or MedChi because the program is run by the HSCRC, CRISP, and MedChi together. And we can do an opportunity analysis for you at no cost, whether you're a member of MedChi or not. We can let you know what bundles you're available for. And the sign up for this is July and August. Now, you might be thinking, oh my goodness, I'm a solo practitioner, or I don't know if I could do this on my own. We've also developed free EQIP entities that you can join at MedChi to help you do it. So if you don't have enough attribution or you need additional help, we can help you out. We currently are running approximately 13 EQIP entities, and we're helping administer countless more on top of that to help physicians take advantage of this opportunity. The other really neat thing about EQIP is that it has actually saved the state money. We had about $30 million in savings in the first year. Oh, check that. It was about 25 million the first year and a little over 30 in the second year. And it's been a really successful program. Very, very exciting opportunity for doctors and something that every physician should at least reach out and talk to MedChi or CRISP about it and see if they qualify for some of the chronic conditions or bundles that are being managed.
Well, it sounds like a win-win. Pretty good program. If anybody wants any more information about anything that was covered today, how can they contact you?
Well, I'm very easy to get a hold of. My email's here. You can call the MedChi Baltimore office. You can reach out. Probably the best thing to do is to shoot an email. But I would also say that it's definitely worth for Equip emailing Crisp at the Equip mailbox or emailing Olivia Simon at MedChi. And also, folks can reach out to you because Elisa, you do a great job working for MedChi and making sure that people who are running private practices in the Center for Private Practice have the help they need. So if you're not sure who to reach out to, just send me an email or send that member number an email and we'll get you in the right direction. I know that there's a lot of change going on and a lot of angst with what's happening in Washington, but there's still a lot of opportunities for value-based care and a lot of opportunities for practitioners. So I just strongly urge people to learn more about the things that are available and we're working on. And please reach out to us if any of this is of interest to you as you continue your journey in value-based care and medicine in Maryland.
Fantastic. Thank you so much for telling everybody about these programs today. And as Jean mentioned, please feel free to reach out to us if you'd like to discuss them further.
Oh, and thanks so much for
And
setting this up today, Elisa. It was great talking to you, and appreciate everything you do for MedChi.
thank you.